Welcome to this episode of Jing TV, where we're going to talk about how to assess low back pain.
Yes, we are.
Welcome to this episode of Jing TV. I'm Megan.
I'm Rachel.
And we're the directors of the Jing Institute, and we get asked all the time, how do you assess low back pain? What are the things that you use when somebody comes in? So we thought it'd be a good episode to talk.
Yeah, and I think often massage therapists have not, certainly in the UK, have not been adequately trained in assessment or consultation, so they feel really ill-equipped when somebody comes in pain because they feel, well, I don't really know what it is, I don't know if it's a herniated disc, I don't know if it's SI joint syndrome, I don't know if it's trigger points and fascial restrictions, so even if they're getting results, they kind of don't feel confident about their assessment skills.
So the first thing you want to do when you're dealing with somebody, because I think one of the elements is people are afraid they're going to hurt somebody, right? They're going to take them out of their normal range of motion, they're going to overstretch them or overtreat them. So the big thing that we say is take a bit of time before you let somebody jump on the table and take them through a full range of motion. So specifically now we're talking about low back pain, but this would be completely appropriate if we were dealing with a frozen shoulder or something else. So
should we maybe talk about the HOPRS? Just give the readers a bit of structure.
If you'd like
the readers, the viewers. A really good way to remember the elements of assessment is by the mnemonic HOPRS. So that's 5 different things to ideally get into your consultation. First one is a case history. So sitting and listening to somebody, asking them questions about the pain condition. O stands for observation, so doing a visual observation of body reading, and that can be quite formal, getting your client to stand while you look at their position, maybe the relative position of their pelvis, the spine, things like that, and we generally do that from front, back and both sides. P stands for palpation, so that's palpating the affected tissues to find out whether, a good rule of thumb is, are they hot, hard or tender? So do they have trigger points, myofascial restrictions? Are they, is there any inflammation going on? R stands for range of motion testing, which was Meg was just talking about, and S stands for special orthopedic testing. So the special orthopedic testing is specific tests that help you narrow down actually what is specifically going on.
So a couple of things to pull out of that. So the H part, so the history, as they sort of tell you subjectively, that can be really key in understanding if it's an acute or a chronic injury, right? So people come in and they're like, I've had it for a while, but you really want to dig a little deeper into, has there actually been an occurrence of an activity? Have they been in an accident? Has that happened within the last 72 hours, or it was something that happened 10 years ago? Also, what I get a lot of is somebody who's had low back pain for 10 years, chronic, but actually, last week or 3 days ago, something's happened. Like they were driving the car and the kid screamed in the back and they jumped. That actually can re-injure the soft tissue and make it more of an acute. So just sort of think about that. So then back to the range of motion testing. So for a low back pain condition, what we'd suggest is that you treat the joint, look at the joint above and below of the affected joint as well, right? So if it's a back condition, we're looking at a range of motion of the spine. Taking them into lateral flexion, forward flexion, and extension. Could do a bit of twist and rotation. The hip, so all ranges of motion of the hip. And both sides. So you do both sides to get a sense of actually what is normal for this person. And then you might want to look at the knee, right? So there's another, there might be another joint that you think is appropriate to look at. And then when you get them on the table, first of all, if you've seen them, what they can do actively, then you can take them passively about 10 to 30% more than what they can do actively. So that can also give you a really great range of how you can treat somebody safely.
Yeah. And classically, if you study orthopedic testing, which we do a course on in Jing,
which has been really popular.
Yeah, it has. I think it's given massage therapists a lot of confidence in their assessment skills. So classically, if you do range of motion testing, we always do active range of motion testing first, because apart from anything else, that gives you a benchmark against which you can measure something at the end. So if at the beginning of the treatment the client can't do a forward bend to tie their shoelaces up, and then at the end of the treatment they can, great, you've got a result. But passive testing can also tell you whether the affected structures are basically muscle, tendon, joint or ligament. And we also do something called active resisted testing, which is where the client presses against you. So lots of different types of movements you can do at the joints to figure out what's going on with the soft tissue. But if you're not doing any orthopedic testing at the moment, just start off with the ranges of movement of the joint actively. And again, we go through all of those on the online course, don't we? I think the other thing that's worth saying as well is that all the elements of the consultation all feed in together. So no one thing is more important than the other. So your case history taking is really important, and we recommend at least half an hour for that, don't we?
Yeah, and I think this again goes towards marketing, you know, if I can say that. Whereas when somebody comes in, make sure that you have enough time before they get on the table and then to close that, so you retest them. Which also allows people to feel like you're quite an authority and they can trust you a bit more.
Yeah. So HOPRS, if you remember all those elements, then you'll be on your way to doing a great consultation. And I've now wrapped things up for today. Come join us, follow the conversation on Facebook. If you're really interested in more of the techniques that we've talked about today, you can come on the orthopedic assessment course, which is fantastic. We run that all over the country, Brighton, London, Edinburgh.
Also the low back pain course.
And the low back pain course, of course, either in hands-on format or online learning. Either of those is great. And follow us on Twitter. We put out some great stuff on there. And subscribe to us on iTunes to get a regular feed about our Jing TV. Yay, thanks for joining.